Alrighty, I'm with Dr. Colin Kingston from Tidewater Orthopedics. He's here to talk about some of the new techniques and trends in joint replacement in sports medicine. Dr. Kingston, welcome to the Hampton Road Show.
Thank you, Chris.
All right, tell me about Tidewater Orthopedics. Tell me about the group and your specialty.
The group is consisting of 10 physicians that subspecialize within orthopedics themselves. This is kind of a new trend in orthopedic surgery where you basically focus in on one part of the musculoskeletal system rather than trying to be the master of everything within the musculoskeletal system.
Pick a joint, knee, shoulder, elbow, what is it? I mean,
it's all of those things. We have doctors within our group, for example, that just specialize in the wrist down, and that's it. We have doctors who specialize in shoulder. We have doctors who specialize in total joint replacement or sports medicine.
How about yourself, Dr. Kingston?
I specialize actually in both sports medicine and in joint replacement surgery.
Joint replacement, I guess you're talking maybe knee, hip?
Knee and hip replacement surgery predominantly.
Let's go with the knee, and I know that there's a robotic procedure out now. Tell me more about that.
Yeah, the robotic procedure is basically designed to increase precision and accuracy of putting implants in that you're using to replace bad cartilage. So what the whole goal there is to hopefully make it more reproducible and hopefully impact positive outcomes.
Okay, for anyone who's watching out there who might have maybe shoulder, maybe knee, maybe hip, or some other joint pain, what is your advice to them?
Well, I would advise them, first thing you could always do is rest, ice, compression, elevation, take an anti-inflammatory medication. If that doesn't work or subside, then I would get seen by an orthopedic surgeon.
Some people put it off too long, and they're really substituting a quality of life when they do that.
Absolutely. I think that people that wait too long, I have patients sometimes that come in that have been putting off, for example, knee replacement surgery. They're debilitated, they've gained weight, they now have diabetes, they're coming in a wheelchair, and they want now to have their knee replaced, but they're not even healthy enough to go to surgery because they can't withstand the anesthesia. I think those people have waited too long. There's a lot of things non-operatively that we can do also to help keep patients going until they are ready for surgery. For example, there's cortisone injections, there's lubrication injections that we can do to help lubricate the cartilage to keep people active and moving.
Tell me more about Tidewater Orthopedics and the group and what you want people to know about you.
Oh, absolutely. Well, we're a group that exists predominantly out of Hampton and Williamsburg. We actually have a collaborative effort with Centera healthcare system, and we're the only orthopedic hospital in the region. It's called the Orthopedic Hospital at Centera Careplex. And I'm the medical director of that hospital, and one of the things that we're trying to implement is, and have a huge impact on, is the patient experience. You know, you can have all these new techniques, all this new technology, but ultimately what it boils down to is what is the patient experience and their outcome. And so that's what we're trying to have, to affect the full continuum.
And it sounds really crucial that you follow through and continue the rehab after the procedure.
Absolutely. Critical part.
How important is that?
Critical.
If you don't, it doesn't work.
Yeah, the outcomes oftentimes are not as good as they could be.
And that's where the hospital comes in. Maybe keep them there and show them the right way.
Absolutely.
Dr. Colin Kingston, thanks so much for the information this morning. Tidewater Orthopedic Associates. There are 2 locations in Hampton and Williamsburg. Give them a call, 827-2480, or look them up online, tidewaterortho.com. Dr. Kingston, thanks again for joining us this morning.
Thank you, Chris.